Hello, this is your Congressman, Michael Burgess. Earlier this month, the Supreme Court announced that they will take up a judicial review of the President's health care law, the poorly named Patient Protection and Affordable Care Act. This government overhaul of the health care system was signed into law in March of 2010. The justices will consider if the federal government exceeded its authority by requiring that every American obtain health insurance by 2014. As a physician, as a doctor, I will be the first to say that the healthcare system was and still is in need of reform. It is essential that the uninsured have access to care, regardless of pre-existing conditions or economic status. At the same time, it is imperative that those satisfied with their current coverage be allowed to keep it. When promoting his healthcare ideas, President Obama said over and over, "If you like your healthcare coverage, you can keep it." And what we've learned is if you like your health care coverage, you might not be able to keep it. The flawed process and follow-through has been abysmal and substandard. In this time of financial uncertainty, we simply cannot afford to buy what the administration is selling, particularly government-structured and unnecessarily expensive health care. Here's the bottom line: we're all going to pay more and get less. The American people made it very clear. Give us reform that will fix problems and leave what is working alone. What the American people did not want was a 2,409-page bill that shatters a system that was working for over two-thirds of the American people. What Congress should have done was tackle the one-third of Americans who needed help. We could have addressed and accomplished reform in smaller, standalone bills at a much lower cost. We have seen that the new health care law is not what people want. I am encouraged that the law will now be heard by the highest court in the land, and I am hopeful that they will overturn this government overreach. In 2009, I started and I currently chair the Congressional Health Care Caucus. The caucus has a website devoted entirely to health care policy. I encourage you to visit healthcaucus.org and receive timely information. As this issue continues to move forward, I will keep you informed. Thank you for taking the time to listen. God bless you and your family. God bless our veterans, and God bless Texas.